Hey. Yeah, I'm talking to you. Do you have ADHD? Do you think you might have ADHD? It's okay. It's cool. Don't worry. That's why this podcast is here. I have a free assessment you can try, and it's at wisesquirrels.com. Head over there, try it out, and see what the results indicate. And of course, take it with a grain of salt, but make sure you talk to a doctor. There's a link in the show notes of this episode just down below. Scroll down. You see it there? Yeah, click that link, and that will take you to the free assessment. Oh, and I also have an email newsletter waiting for you at that same link that includes a weekly email with a great tip to help you get through the week. Welcome to Wise Squirrels, the podcast for late diagnosed adults with ADHD. I'm your host, Dave Delaney. A quick reminder today, as always, the content provided in this podcast is for informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. I'm not a medical professional, so always seek the advice of a qualified healthcare provider regarding any medical condition, including ADHD, of course. Reliance on any information provided by this podcast is solely at your own risk, so go talk to your doctor. My guest today is Dr. Russell Ramsay, who is a psychologist specializing in the assessment and psychosocial treatment of ADHD. He has a solo virtual psychology practice that you can find at cbt4adhd.com. And Dr. Russ has an impressive background. He's a Ph.D. He's a retired professor from the University of Pennsylvania. He co-founded the Adult ADHD treatment and research program there, and he was a professor of clinical psychology. Dr. Ramsay is a board certified in behavioral and cognitive psychology. He's a diplomate of the Academy of Cognitive and Behavioral Therapies, and he's an expert in adult ADHD. So I'm very happy to be chatting with him today. He has authored 5 books on adult ADHD, including Rethinking Adult ADHD and the Adult ADHD Tool Kit. Dr. Ramsay's work has also been translated into multiple languages and is recommended by the ABCT. He's received awards for teaching and research excellence and is in the CHAD Hall of Fame as well. And Dr. Ramsay's contributions to adult ADHD assessments and psychosocial treatment continue, as I mentioned, in his virtual solo practice that I encourage you to check out as well. Before I jump into the interview, I did want to share a quick thank you note to everybody at the Mental Health Marketing Conference in Nashville. I was there to speak and deliver the Root Down, which is my brand new keynote presentation that I've been plugging on this show. So I won't talk about that, but I did want to say thank you to everybody. We had a small but mighty turnout, and I was thrilled with the feedback. So if you are here because we met at the conference, leave a comment, say hello, reach out, don't be shy. I am always open and excited to meet new friends, especially new Wise Squirrels and new allies of Wise Squirrels as well. Okay, let's get on with the show. I've been excited, obviously, to have you on the show, and you've written what, five books? Is that right?
Yeah, 5 books. I count it's the first and second edition of the Cognitive Behavioral Therapy for Adult ADHD, so I count that as 2 because it was really a big overhaul. So so it's going to be number 6 coming out in May.
Yeah, congratulations, by the way. That's a huge undertaking. I've written a book myself, and it was pre-diagnosis with ADHD, so naturally it was not the easiest thing I ever did. But yeah, let's talk about your background a little bit first. Like, what got you? Obviously, you're a licensed psychologist. So tell me a little bit about your background and what got you interested in sort of that ADHD space.
You know what? I started at Penn as a postdoctoral fellow at the Center for Cognitive Therapy back in 1995. And ADHD was not on my radar screen. It wasn't until I was approached by Dr. Tony Rothstein, the co-founder and for a long time co-director of the program, approached me about the possibility. He said he could handle the medication side, but it would seem like some sort of psychosocial treatment would be useful. And we hit it off, and it's been a great collaboration over the years. We both left Penn since then, but it's probably some of the best work we ever did, and that's how I got into adult ADHD. I like to say I'm dispositionally lazy, and there was very little literature to review at the time, so I got in on the cheap. But hopefully, over time, developed like some assessment protocols. We and others, colleagues around the world, independently were focused on cognitive behavioral therapy for adult ADHD, which is now viewed as an evidence-supported treatment, psychosocial treatment for adult ADHD.
It's amazing. What were some of the insights into the program's achievements that you were doing at Penn, during your tenure there?
Well, like I said, I think we and other programs are doing the same thing, because the diagnosis is difficult. Even doing it for a long time, many of the ADHD symptoms are nonspecific. The example I use is like in a general medical practice, like a fever. You go to your doctor with a fever. It could be the flu. It could be an infection. It could be malaria. And just like inattention is pretty ubiquitous in depression, anxiety, and other things. So, focusing on how do you sit with people and figure out whether it's ADHD or not, in addition to the fellow travelers like depression and anxiety that can go along with ADHD. But hopefully if there's any lasting thing, it's the modification of cognitive behavioral therapy for adult ADHD. Like I said, we have many colleagues who are also friends around the world who are working on the same thing. And when we get together and talk about it and present together, we agree we're pretty much all circling around the same thing. But I think we would all agree the name of the game, there's no trade secrets. It's more about the implementation. So I think that's something like helping adults with ADHD. And I think that was also the executive functioning model, the self-regulation model of ADHD helps with the assessment as well as the treatment. And people like Tom Brown, Russ Barkley, and others were leaders in identifying that and popularizing that. But it's also backed up by research as well.
Yeah, it's been an interesting time for me discovering, learning obviously about ADHD for myself, but also, watching a lot of presentations and learning about, experts in the field like yourself. I think of, you mentioned Dr. Russ Barkley. I know there was like an event where I guess it was at probably the Chad Atta conference where and I'm kind of paraphrasing here, but my understanding was that Russell Barkley and Dr. Ned Hallowell were kind of on stage, and Ned is sort of this kind of teddy bear. I mean, with all due respect to both of them, and then Dr. Barkley is more like a curmudgeon, like kind of straight from the shooting from the hips kind of guy, but they both kind of came to this consensus. I think the question was, is ADHD a good thing or a bad thing? And I think they came to the consensus that like if it's treated properly, it could be a good thing. And if it's not treated at all or not treated well, then it could be a bad thing. What are your thoughts on that take?
I mean, that sums it up. I mean, when you think about it, and some of this comes from the work of Barkley and Brown and others, but the executive functions helped early humans work and play well together with other early humans, and it had a survival benefit to doing that. Working together, we're better together, if you will. The executive functions allow us to adapt to our surroundings. And so how I've phrased it, one of the frustrations expressed by many adults with ADHD is the consistent inconsistency. I know I can do it. I've done it before, but I'm not 100% sure I'm going to be able to make myself do it when I have to do it. And that can be maddening. If you know you can be a really good writer sometimes and you have another writing assignment, but you can't draw on that past experience to be able to get started now and have confidence that you'll be able to finish this essay or this report. So I think adults with ADHD might be particularly sensitive to contexts. There can be situations where somebody's a rock star. Adequate support, checking in, hands-on stuff, or things with clear objectives, whatever is the strong suit. But then you you shake it up a little bit or twist it around a little bit, and then it's a dumpster fire of difficulties. So I think, yeah, it's, it sounds like the clinician cop-out answer. It depends. But I think with ADHD, especially adults with ADHD, very sensitive to surroundings, and can do quite well with supports and following interests and passions. But there can be some other have-to things that can really undermine them.
And you mentioned
it's a little bit of both.
Yeah, you mentioned one thing there that stood out to me about kind of helping people get started. They know what they need to do. Right. But they're not getting started. Are there tips or any ideas there on how to nudge somebody to get started, to get the thing, or get it done, or get it started at least?
Yeah, I mean,
I'm asking for my wife, by the way.
Yeah, sure, of course. What's the old psychiatrist joke? I have a friend.
Right, air quotes, yes.
Yeah, exactly. No, you know what? One of the things I found helpful, there's a particular type of procrastination called procrastivity. I did not invent the word. It's been out there. If you can trust Urban Dictionary, it's been around since 2010. But it's how, the example I use, you're working on taxes or doing something else that you just really hate doing. All of a sudden, you're magically motivated to mow the lawn, clean up the kitchen, do something else that you might have been procrastinating on for the past week. But compared with the more difficult tasks, now you can get it done. and I took a look at some of those tasks and reverse engineered it pretty much and said, what is it about those tasks that at that moment make them preferable? And are there any tips in there? So the tasks tend to be more hands-on or manual. That you can touch it, it's physical. So if we do that with something we're avoiding, now something like doing taxes or writing an essay or a report, those are still very cognitive tasks. But if we can make the getting started, like going to a workstation, like sitting down at a desk, logging on, opening up the spreadsheet or the document on the computer, walking into the kitchen and opening the dishwasher door, we could stop there and still procrastinate. But that's like one small tip that comes from that. The other things are pre-commitment. Having a specified day and time that you intend to do the task that's realistic, because that specificity seems to be helpful, and also some sort of task bounding. I'm going to work on this for 15 minutes, 30 minutes, or I'm going to write at least 100 words. However you frame it, so you view it as doable, and that answer might be different for you than it is for me. But getting it to the point where you go, well, yeah, I can at least do this, and the very fact, or the very process, I should say, of going through these steps and thinking them through, maybe writing them out, it's also, we could call it cognitive exposure. It makes you still think about the task rather than escaping it and escaping into action by doing something else. And all these things, they're like swing votes, increasing the likelihood that you're going to get started on the task. The relapse rate for procrastination is 100%. We will do it, and not all being off task times are necessarily procrastination. Sometimes it might be, tell you what, I don't feel like doing this because I'm really tired. I need a break. I've been doing a lot of work already today. There's a step I need to do before I start writing the report of gathering data, something. Those are not procrastination. There are things that still have to be done. But going back to and also when you're planning to do something, spending a moment or two for what I call the valuation of it. Why do I want to do this in the first place? What's in it for me? What about this might I be underestimating in myself? Hey, I'm a good writer when I get down to do it. But it can also be something like, I just don't want to have to think about this after today. And that's motivation too. But a couple of these steps, these can they're like swing votes in Congress where it nudges it where we might be a little more likely to get started a little earlier than we would otherwise.
And for God's sake, vote. Right?
Yes, obviously. Yes.
Both politically speaking, but also as a new American myself. I just became an American citizen just a few weeks ago. Yeah, thank you, from Canada originally. Yes, my home and native land.
My father's side of the family, well, originally Scotland, but they were Canadian and both went to the University of Toronto.
Oh, nice. Yeah, we just did a tour of UT with my son, or U of T, I should say. So he may be getting back to. Both my kids are being raised here in Nashville, but both were born in Toronto. So, who knows? We'll see what happens there. What part of Scotland?
It was a small place called Nairn, but I've also heard it pronounced as Narn,
okay.
Nairn, at least to my knowledge. Mm-hmm. That's where they're from, but yeah.
I lived in Edinburgh for about a year, and
lovely.
And we took the family, the kids, and my wife. We all went back. My wife and I both lived in Edinburgh together. So we brought the kids last year and gave them the grand tour of Scotland and went up to the Highlands and Isle of Skye. And it's gorgeous. It's gorgeous.
Yeah, I had a good chance to go to Glasgow a couple times. Once the World Federation Congress of ADHD was there back in 2015.
Nice.
And then the family went there, and we visited Edinburgh, Glasgow, and the Highlands. It's lovely.
Yeah, it's a beautiful part of the world. That's interesting. That so you mentioned being in Scotland for that conference. I've had some conversations with some doctors and coaches and things about culture and how it plays out as it pertains to ADHD. Now, obviously, ADHD is blind to our upbringings and our backgrounds and such, but some cultures are less quick to diagnose people, and maybe even anything for that matter. Certainly with any kind of like psychotherapy or things like that. Is that something you've come across, and with different cultures, different people, backgrounds, faiths, all that stuff?
Yeah, I mean, you could go with the culture of within a family where one parent sees the benefit of medications and somebody else is skeptical about it. Cross-culturally, some of the different rates. I mean, they'll generally cluster around similar prevalence rates for ADHD, but you'll have some, like I remember one study where I think there were much lower rates of ADHD in Italy. There can also be, various differences in terms of, how do you define a diagnosis? How do you define a symptom or a behavioral problem that needs help? Who do you go out to? Different communities. Black Americans can be very skeptical of some of the medical professions, and rightfully so, based on some past history.
Yeah.
And also different groups have different avenues of seeking help. Some groups it might be more faith-based first. It could be the family doctor, and others might rely on the family and not want to go outside the family. So there are a lot of individual differences, but I think as you alluded to, even with all these group differences, the numbers don't lie. Wherever there's a human brain, there's going to be the possibility of a prevalence of ADHD. And we could say the same about depression or anxiety, even though there might be differences in how different groups define these and define seeking help.
Yeah, it's interesting. I'm kind of thinking along the lines of like the blue zones, study or studies about like longevity, like healthy longevity, and kind of narrowing down what these different groups have in common as far as diet and lifestyle and social circles, things like that. So I suppose there isn't really. I mean, ADHD is ADHD. It's just like our operating system, is it not?
Well, that's a way to think about it. In a way, like if we think about it as an executive functioning problem. Now, even using executive functions, if we broaden that, we think about it as a self-regulation problem, and there are other facets of self-regulation outside of or overlapping with, or like Jeff Newcorn, Dr. Jeff Newcorn, I love the phrase he uses, interdigitating. But they're around like how efficiently do we do what we set out to do? So on that front, that is a guiding system for most people, most humans. And I also think that this is why the problems of ADHD feel familiar to a lot of people who don't have ADHD, and hence the myth, doesn't everybody have ADHD or a little bit? And no, not really. Now, it does fall on a continuum. It's a matter of degree. It's not like there's a hard marker between you got it or you don't. I forget who said it, but he said, it's hard to tell when day turns into night, but it most decidedly happens.
Mm-hmm.
And that's how it is with ADHD. Where do you draw the diagnostic line? But it's usually clinically, we're looking at functional status. Is this getting in the way of your life? And if it's like sub-threshold or mild, but still causing problems, well, then it's worthy of treatment. But going back to, this is where I think it is a core feature, or like the executive functions, the self-regulation is a part of our factory settings, if you will. And like I said, I think that's why some people might have a hard time understanding it or thinking that everybody has it when in fact, no, not really.
Are there estimates? I mean, I know there are estimates, and the last I saw, I think, was like 20% of people with ADHD don't know they have ADHD. Are there like more up-to-date or more accurate numbers that we can go with? I know like it's 5% of Americans, or up to 5%, which is 8 million, and 20% of adults don't know they have it. Is that, does that resonate with you? Or
yeah, and I think, you know what, actually I might have heard it maybe flipped a little bit, where there might be a somewhat higher rate of unidentified ADHD in adults or untreated.
Yeah.
Even though I think there's been some correction since the pandemic and things like that, and greater emphasis on mental health and increased access during the pandemic, which hopefully with remote treatment will persist well beyond it. But I think generally we're still talking about, some of the numbers, probably the adult numbers are going up a little bit, but still within that like 3 to 7 range. But also because we spend more time in adulthood, so in some ways there's going to be we spend more time in adulthood than in childhood, so there's probably going to be some more more later identified individuals there.
Yeah.
But I think there's still an underrepresentation in terms of people who could benefit from specialized treatment.
Oh yeah. Now that I know I have ADHD, so often I've said this on the show before, but like I'm at the grocery store checking out, I'm like, yeah, this clerk totally has ADHD. Like I see it everywhere. Not to say that I'm like or even trying to diagnose somebody, but I'm like seeing things that kind of resonate with me that way, that I think like, I wonder if this person. And I did read too that there was an uptick in diagnosis, especially during the pandemic, because and you touched on that a little bit, like more people were working from home. And so if one of your kids or your kids have ADHD and you're working from home and you're with them all the time, you start seeing, oh, wait a minute, you start seeing some of these traits in yourself, or that just the change of scenery or your office space, completely throws you off from working from home. Or more people are spending more time on social media and watching TikTok videos, God forbid, and learning about it that way. So it's interesting.
Well, you know what? And when we think about self-regulation, we sometimes overemphasize the self, even though that's part of it. But things like the structure of getting up and going to the office, that creates some self-regulation. When you're at the office, you're physically protected. I mean, we always got our phones with us, but from some of the distractions at home, or getting up and going to school, or going to campus and then having access to the campus library, just getting ourselves to certain places. If you've ever woken up to an alarm that you set, that's self-regulation. Or set something by the door so you didn't forget to take it with you. That's self-regulation.
On the topic of self-regulation, I think about, obviously with addiction, that in my understanding is that's a big problem for folks with ADHD. Can you explain that a little bit? I know it's to do with the lack of dopamine, right?
That can be part of it. There can be many causes. There is the self-medication hypothesis, that it is an effort at self-soothing, and with different different substances having different effects. It can be perhaps, talking about sensitivity to context, maybe being around others who are using and upwards of abusing, substances, where it becomes part of that subculture, if you will. There can be, simply the genetic predisposition towards addiction or some combination thereof that can lead to that increased risk factor. Now, I know some recent studies have shown that, because there's some concerns about the medications, often the stimulants used for medications, but there were some recently published studies. One was tracking high schoolers into young adulthood who were they were on prescribed stimulant regimens for ADHD, and another, I think, was a cross-section of adults with ADHD. And both studies, using different methodologies, found that taking prescribed stimulant medications does not increase the risk for addictions beyond the population risk. You're at no greater risk than anybody else in the population. And also, it would seem like if we're effectively treating ADHD, that should reduce the risk for it. Maybe not eliminate it. That's the things, being a clinician, you'll always see the outliers, but it should greatly. It would seem like greatly reduce that risk, and or also be a benefit for people in recovery or trying to reduce their substance use.
Yeah, so I quit drinking 3 years ago, and I quit smoking cigarettes like 20 some odd years ago, but certainly when I was younger, I would smoke like a chimney. I'd finish a pack and I would drink like a fish often. Also knowing my own limitations. For example, my father was a pretty heavy drinker, but would drink like Scotch, whiskey. And so I knew better to tend to avoid such alcohol. So I would drink beer. And as far as like drugs were concerned, like I did know people who got into some pretty serious drugs, and I always avoided those drugs because I knew I had a tendency to kind of be excessive with things. And so it's interesting reflecting on this, and part of it too, and I guess the question here is, maybe in the studies you've done or in the patients you've had, when somebody is diagnosed with ADHD later in life, and this is something I'm experiencing, I'm often wondering, I'm not reflecting on the past too much because I know that can get to bad places, and that's not my intention. But I do think a lot, like, for example, I'm a very funny person usually, I promise. And, I'm quite, the life of the party, quite humorous and things like that. But I think sometimes, like, maybe I was being really funny as a kid, certainly the class clown, because I couldn't sit still, or because, and so it starts to make me wonder, like, how much of my personality is because of ADHD or undiagnosed ADHD versus, like, it's just Dave.
Well, you know what? How do we... this is a question Tony Rostan and I would bounce back and forth. How do you differentiate, like, ADHD and the executive functions from personality? Because we're talking about some of the more persistent parts of oneself, and interacting and dealing with a variety of individuals and contexts, and bringing that back to, if we think about humor, it's being able to see things in a different way. And also, if things are boring and you can make them funny and get a laugh out of it, that's a way to pay attention and sort of self-stimulate oneself, and make something, being able to sustain attention by looking for or thinking about a wisecrack, or, stay engaged in some way. So it is an effort after attention in a way. Now, can it get you in trouble? Sure. And are there times it's really, you could say anybody could say the wrong thing at the wrong time to the wrong person? Absolutely. But yeah, that's one of those things to consider. And ways that, for lack of a better phrase, somebody could take their, like, for lack of a better phrase, ADHD personality or these predispositions, and also find a way to hone it and make it work for them.
Yeah, because I go through periods, I work for myself. I'm an entrepreneur, and I have my own business, and I do a lot of public speaking for my business, things like that. But now that I've been diagnosed, like, ask me what executive functions were last year, I had never even heard of them. And now I can't say I'm obsessing about this, but I did launch this podcast and Wise Squirrels website.
Right.
And now I tend to find that sometimes I feel like if I didn't know about my diagnosis, I'd be in better shape. And I'm sure that's wrong, but I don't know. It's just part of the struggle, I guess, of being diagnosed kind of late in life.
Yeah, and I know that ADHD is one of those diagnoses, and it can lead in some ways to it being minimized, that it's viewed as, for lack of a better phrase, quaint or a nuisance, or hey, it's my ADHD. It's almost like a brand name like Kleenex or Xerox that is used, and it sort of loses its meaning or its credibility, for lack of a better phrase.
Yeah.
And so, we want to be careful with labels, but ADHD is one of those. If it's being thought of as there is a, I don't think style is the right word, or maybe a temperament that goes along with it. Now, again, there's a lot of diversity within people that share the diagnosis of ADHD, but if it's viewed more as like cognitive predispositions that have some challenges that come with it, but also some predispositions that in the right setting with the right people, with the right encouragement, can, support people and doing wonderful things. And like you launching a podcast based on your curiosity about it once you got the diagnosis, I mean, that's part of the clinical craft, if you will, coming from it, as I do as a psychologist, is helping people find their way to that. And like a line I used several times, there's the idea of rehabilitation. How do you get yourself back to a previous level of functioning, like if you have a knee injury or something like that? There's also within, I think, that literature, what's called habilitation. Take the RE off and just habilitation, which is making the best out of what you got. And I've not yet found this word, so this one I'll take credit for inventing, but somebody can prove me wrong, and I'm happy to give credit where credit's due. But sometimes at its best, me being a therapist, how therapy, but combined with medications or whatever works, we're looking at abilitations. What are some of the abilities that previously undiagnosed ADHD might have covered up or interfered with? And these difficulties can also take the form of self-doubt, self-criticisms, and avoidance, assuming one can't do something, and maybe re-explore some of these new opportunities or old opportunities, pick them up again, now that there's the understanding of ADHD and how one's brain works. So that sort of habilitation of, hey, let me try this again, or this thing that I thought I couldn't do, let me give it an honest try and at least find out by trying, and sometimes being able to do things and assume roles that people thought they couldn't.
Yeah, I sometimes think for my own business that, like, if I found a co-founder who was, like, quote unquote neurotypical, like, we'd be like, a force to be reckoned with.
But that's like one of those things, like finding partnerships, and yeah. I without geeking out more than I have, there's some like research collaborators who they go, hey, this person's really great at the theory, I'm great at the methodology. It's sort of like the old Reese's peanut butter cup commercials, where you'd see somebody walking down the street eating a chocolate bar, somebody walking down the street for some reason with an open jar of peanut butter, and they would run into each other, and they'd say, you got peanut butter on my chocolate, you got chocolate on my peanut butter. But the tagline for the peanut butter cups was two great tastes that taste great together. Yes.
And how many times have that happened to me with the peanut butter?
Every day. Somebody's running into me with an open jar of peanut butter. Yes.
I think they're only running because there's bees all around them trying to.
Right. That's right.
Tell me a little bit.
Instead of looking at their phones, they're looking at their edible, whatever they're eating, walking down the street.
Exactly. Hey, by the way, speaking of edibles, CBT. Obviously, what are your thoughts on that new confusion?
I tell you what, you want to get a lot of hits. Like, just misspell it and say Dr. Ramsay's talking about CBD for ADHD.
Yeah.
No, people get really excited when they mishear that. You know what? To date, I'll make it simple. I'm not aware of any compelling evidence that it's helpful. Some people will use it, smoking marijuana or using edibles or something, trying to reduce anxiety or, be able to fall asleep, quiet their mind. And I'm not going to tell anybody it's not working, but it may not be directly treating ADHD. It might be some of the side effects, and there is some evidence in some very specific cases of particular types of anxiety or other medical conditions where various forms of cannabis, and I know there's many differences that are beyond me without checking notes, but in terms of helping ADHD, there's no at least existing credible evidence. There might be studies ongoing. I think it should be studied. But if nothing else, it may actually interfere or make ADHD worse, and particularly for teenagers.
Yeah.
But these, and like the question, we don't know about psychedelics, but hopefully there's going to be some randomized studies about safety and tolerability, and seeing what works and how, if it does work.
Yeah, because I almost think with like anxiety, and in my totally novice mind here, but I'm almost thinking like if they were to turn to like say weed to help them with anxiety, but they have ADHD, then that could, not to say that weed is addictive, but different habits can be addicting at least, and you don't want to be turning to pot. You don't want to be like Seth Rogen, or unless he's very successful. Right. It may be a bad example.
Sure.
But you don't want to be just like a pothead, basically. To get
it becomes a behavioral habit. It becomes associated with, if I do this, then I can fall asleep.
Yes.
I'll share. I'm a coffee drinker.
Me too.
And it becomes associated with when I have work to do, I'll start going to fix a cup of coffee, even if I catch myself, because it's part of the behavioral script. And this is another one of these things that we can use, part of that, making the task manual to get started. It could be, I'm going to get to where I do work, and that might be the library, or when I'm working on a writing task, I'll go to a coffee shop near me. So it can become part of this routine, just like hopefully flossing becomes part of our brushing routine. But the other thing, and this is, I'm not sure if there's evidence to support this, but anecdotally, like the day after smoking marijuana, I've heard enough people say to me that they suffer from amotivational syndrome. Now these might be idiosyncratic. On the other hand, I don't want to oversell something, but this is where clinical practice, you look at the individual. Just like not everybody responds to prescribed stimulants who has ADHD, even though we know the general research is that they're quite beneficial, but there's going to be the people within those samples who don't respond and need other sorts of treatments and supports.
Yeah, and you'll have to excuse me for not reading your book, Rethinking Adult ADHD, but tell me a little bit about
Well, it's only you and like 10 million other people, so it's really a small who haven't read it yet. So.
There's even more who haven't read my book, so don't feel too bad. But yeah, tell me a little bit about some of the key kind of takeaways from the book about rethinking this.
Well, the main takeaway, the main reason I did it, it was published in 2022. It actually came out like December 2019, but 2020 copyright. And it was really a more than a decade long in the coming answer to a question I was asked in a conference in 2002, which was, what is the cognitive theme of adult ADHD? So within cognitive behavioral therapy, different diagnoses or different conditions, if you will, they might share some of the same distorted thought categories like all or nothing thinking or negative fortune telling. But there's going to be different themes. Like for depression, common theme is loss of opportunity, loss of esteem. With anxiety, it was typically the assessment of risk and maybe the overestimation of risk. And even more recently and more relevant to adult ADHD, and this is part of the forthcoming book, the issue of intolerance of uncertainty that goes along with anxiety. And I make the case in the forthcoming book that ADHD is an uncertainty generator. I know I can do it, but I'm not sure if I will when I have to. So running through it, it was part of taking a look at the cognitions, emphasizing the cognitions with ADHD and the role they play in procrastination and other things. But I guess the main takeaway that I wanted to achieve with it was I concluded that, and this is anecdotal, this has not been studied, even though some colleagues have said they might look at it, but my contention is, and based on some clinical experience, and that the main cognitive theme in adult ADHD is self-mistrust. I know I can do it, but I don't trust myself that I will be able to do it when I have to do it. Similar to what I said before, I've done it before. I know I can do it. It's not lack of capacity for doing it, but I don't know if I'll be able to get myself to do it when I set out to do it or have to do it. And that consistent inconsistency, the consistent uncertainty, that is stressful and frustrating. And that part of at least the cognitive work is building up increased self-confidence and trust, in addition to other things. But if we're talking about the central themes, now it's not done in isolation. It comes from actually facing and doing things, the implementation of coping skills, increasingly being able to get engaged and get started with what we want to do and make progress and reach a point of completion. And throughout that, this is very important too, the personalization. It's not one size fits all. What works for you might not work for me, might not work for somebody else, but elsewhere, I've used the analogy, they're like recipes that people then adjust and season to their own taste. So there might be some general principles in there, but what works and what tastes good for one person will not for the other person. But it's a good starting point in terms of helping people getting to where they want to go.
Yeah, and I can certainly attest to the feelings of self-mistrust. I haven't thought about it worded that way, but yeah, you kind of nailed it there. That's great. What are some misconceptions that people find, when it comes to ADHD?
I still think there's some myths that everybody has it, which is a bit of a dismissal of it.
Yeah.
I think one of the ones we still hear is it's setting up some condition. If you got through high school, you can't have ADHD. If you got through college, you can't have ADHD. If you've been working at this job for more than 5 years, you can't have ADHD. You're too smart to have ADHD. You're too accomplished to have ADHD. And there is solid literature. Now, ADHD is not a measure of intelligence. Now, some facets here and there of executive functioning difficulties can affect some subtests on intelligence scales, like working memory task or speed of processing task, but they are different. But some studies have looked at high IQ individuals who also report significant executive functioning problems. Some of the work of Tom Brown and Kevin Antschel have identified like ADHD in high functioning, high achieving individuals. So again, wherever there's a human brain, there can be these sorts of executive functioning difficulties. I think one of the other myths I've referred to is that the stimulants are scary. Now there are medications, but taken as prescribed, they're among the more effective, and I'm a psychologist, I can't prescribe, but based on the research, they're among the safest we have. Like I mentioned, the recent studies saying that being on a decently persistent and monitored dose of stimulant medications for ADHD does not increase the risk of addiction. There's no greater risk for addiction than anybody walking around in the general population. So there's still a lot of those things out there. Even going back to something I'd mentioned before, and we were talking about the increased numbers of the diagnosis that can lead people thinking about, oh my gosh, it's everywhere, everyone has it. We're probably really talking about a correction based on the studies I think we both mentioned before, of that there are probably a majority of people, based on the prevalence rates, probably many more people walking around with unidentified ADHD that have not yet been identified and not yet received specialized treatment. And that's another thing. There are competent treatment assessment protocols out there that can be used, especially for establishing the initial diagnosis of ADHD, published by Margaret Sibley, whose work I really admire, and getting a competent evaluation with a professional familiar with ADHD.
Yeah, I had a conversation with someone a while back, a doctor, and he expressed the annoyance or frustration in sort of the process of being medicated. So I personally am medicated, and I'm on, I guess, my 6th month, I think. And I started on one medication, did it for a couple months, changed the dose. It had some weird side effects, so switched to a different medication, and then have just this month actually reduced the dose because of some side effects. Nothing scary or terrible, but I don't want to scare people because I do think it is important to do this. But his concerns or frustration was in what he explained was that back at some point you would be diagnosed with something, like a low dose. And after a week, you'd see your doctor talk about it and then maybe increase that dose by a little. And then the next week, follow up with your doctor and, kind of rinse and repeat. And because of insurance companies and the way this all plays out now, you basically get diagnosed or you get prescribed something for 30 days. And then, you might get a consult with your doctor, or you might just have to follow up and say, like this, don't like this, and then change. So what are your thoughts on the best, again, I realize you're not prescribing, but in your studies and experiences, is there validity to this? Would it be better to have more frequent updates and maybe more frequent changes in the dose?
Depends on the medication, because there are some non-stimulant medications that might take longer to become active and to notice the changes. But working with a lot of psychiatrists, now this is a guideline, so don't take it literally.
Yeah.
But one of the ideas is because many people, if they're responders, adults with ADHD prescribed a stimulant, they'll notice things the first couple days, the first week, and then the thought is, okay, we're seeing it's working. Let's increase the dose a little bit. Sort of what you outlined there.
Yeah.
And this would be the going. I wouldn't even call it a guideline. It's sort of like one of these rules of thumb. You increase, within the safety limits, but you increase until you hit side effects, and then you taper back a step. And that way you can optimize the dose, because a certain, let's just say, not talking about a specific medication, but let's just say 10 milligrams works really well, but maybe 15 or 20 works better. And it's not sort of like, oh, if we can get you up to 20, you can work for 20 hours a day and focus. No, we're talking about functioning, including things like driving safety, being able to read to your children and focus on things like that. So there is something for that tweaking, or if something's not working, being able to change quicker rather than having to wait 30 days. Now, very often, even within the 30-day limits, if you will, there might be ways that a psychiatrist works with somebody to, sort of make changes within their, all legal and within, all the appropriate, professional standards, but to work within some of those insurance limitations to still deliver good care.
Yeah, that's helpful. Thank you. I know I'm being mindful of the time here, and I know you have a hard stop. Do you have any quick tips for better knowing yourself or understanding yourself, and then respecting yourself, and then connecting yourself, finding community, finding people to connect with? So know yourself, respect yourself, connect yourself. Any thoughts or tips around those 3 categories?
You know what? I would say monitor your thoughts and feelings, and even the unpleasant ones or negative ones, look for the element of what might be positive about them. Now, maybe they're experienced at too severe a level, like guilt and shame, But even if we dial guilt back to say maybe 3% of that is, all right, this is me taking responsibility for myself. So even though this feeling is unpleasant, now I shouldn't be experiencing 90% guilt because I showed up at my dentist's office on the wrong date. But part of this is, all right, that reaction is me taking responsibility for myself. So that's a positive, but I want to dial back the guilt and, okay, and this could be a related principle for knowing yourself or dealing with the knowledge of yourself, is then keep these slip-ups, make them behavioral, not personal. Okay, I wrote the wrong month in my planner or in my Google Calendar. The other part of knowing yourself is, how do you make sense of things? What are your reactions? How do you think about what happened? How does that make you think about yourself? Yeah, you probably know one of the early, if not one of the earliest popular books on adult ADHD was entitled, "You Mean I'm Not Lazy, Stupid, or Crazy?" Mm-hmm. Because that tended to be the attributions of, and still to this day, the attributions of adults with ADHD. So question those. They may be coming from a good place. I want to get started earlier on these things. So knowing how you're hard on yourself, and also a nice flip on that is, and it's one of my favorite, is perspective taking. If somebody I knew with ADHD, this happened to them and they had this thought, would I agree with them? But how would I talk them back from that? Still, I mean, you can still be honest about slip-ups, but that what I mentioned about keeping it behavioral, because if it's behavioral, then we can correct it and change behaviors rather than saying I'm lazy, stupid, or crazy. It's hard to change character flaws. So I'm not sure if that maps onto everything, but with that, you know what, it is, finding people who are willing to be understanding, whether you share ADHD with them or not, but willing to be understanding, that there's a reciprocity back and forth. And you mentioned the International Conference for ADHD. That's always a good venue, and there's many local chapters of CHAD and ADA where they're offering opportunities for that sort of community, and you might look to join up there, some of those.
Yeah, that's great. And I'll include links to everything we're talking about here in the show notes for folks to check out. With just a few minutes left, is there anything I didn't ask you about, or anything you'd like to share that I didn't bring up with you?
No, I mean, we covered that, and what you mentioned at the end about knowing yourself and connecting with others. No, I thought that allowed me to bring up some of the stuff, about how you think about yourself, your relationship with your feelings. I mean, managing ADHD requires facing some discomfort, short-term discomfort, but getting through it by engaging in what's important for you, what you value. And then once you get to the other side, it's like Tom Hanks in the movie Castaway paddling over the waves, but finally getting over them. Now, again, the example breaks down there because then he was alone in the middle of the ocean. But sometimes if we should just shorten it up and saying, it's getting over that big, intimidating wave, but when we're over that, you get smoother waters, which we know. But that's the implementation issue with ADHD. So that's why valuing, keeping in mind why you value what you're doing, even if it's just to get it done and you get over that wave, and you just increase the likelihood of getting to the other side and building confidence through experience.
And tell me a little bit about how folks can, learn more about what you do. I know you switched to virtual sessions, right?
Right. I'm no longer at the University of Pennsylvania. I retired from the University of Pennsylvania, but I'm not retiring. I'm not stopping by any stretch of the imagination. But I have a solo, completely virtual telepsychology practice. But if you want to check things out, and I have I'll recording some podcasts on there and other things. The website is www.cbt4ADHD.com, and the email there, my pen email still works if you track me down that way, but it's my last name, Ramsay, Ramsay, make sure you get the A in there, at cbt4ADHD.com.
Yeah, this has been fantastic. So I really do appreciate you sharing your insights and smarts and encouragement. This has been great.
Oh, great. Well, Dave, thanks for inviting me. You're a great interviewer.
Thank you. Thanks for listening to Wise Squirrels. I'm Dave Delaney. The music to the show is Unyielding Conditioning by the one and only Fishbone. And you can find that song and all of Fishbone's music wherever you stream music. We thank them for this. We love Fishbone. Are you a wise squirrel? Visit wisesquirrels.com to find out. And let's keep the conversation going. I'll see you there.